Hello, my name is Melody Hartzler. I'm a clinical pharmacist and the founder of Functional Medicine CE. I'm here today to talk to you about our broken system. Are you a healthcare provider who feels like you're doing everything right and your patients are not getting better? If that's what's happening for you, this conversation is definitely going to be one you're going to want to listen to. So, we've been practicing in one of the most advanced healthcare systems in the world. We have incredible diagnostics, we have powerful medications, we have more clinical guidance than ever before. Yet, our patients are still sick. The chronic disease is still on the rise. Patients are on more and more medications, and burnout among us healthcare professionals is at an all-time high. And here is really, I interviewed pharmacy students for a really long time. When I was working in academia, everyone said they went into healthcare to be someone that helped people heal. We're all healers at heart. We want people to feel better. We want them to thrive. And unfortunately, in our system, when we're just continuing to add medication after medication, we often feel like we're running on a treadmill and we're not actually getting people well. And so if this resonates with you, I want to talk to you today about some of the things in our system that can be helped by certain types of approaches that we take as clinical care providers. And it's not a failure of your effort at all. It is not a failure that you are not caring enough or you don't have enough time. It's really a failure of the system. And so that's what we're going to talk about in the next few minutes. The current US healthcare system, we have drug discoveries, we have disease treatments, we have, again, symptom management, and we're not actually getting people to be well or fix their problems. Certainly in ID, we're treating an infection and they get better at the expense of changing their microbiome oftentimes as well. But a key feature of our healthcare system is the sick visits. And so it's really, that acute condition, sending them out the door, doing a surgery, doing some kind of quick fix and not actually working with them on preventative health. So we have this fee-for-service reimbursement, we have acute care approach, and then we largely ignore subclinical disease. So what I mean by that is if someone comes in and their thyroid's not optimal, if it's not out of that really wide range, we're not treating it, or we're not looking to see, do they have autoimmunity that's causing this? Are they reacting to things that they're eating? Are they, if they have a vitamin D level of 31, are we saying, okay, that's great, is, potentially not optimal, even though that's right above, where the lab cutoff range is. So if people are, having fatigue, we might just be saying, okay, your labs are fine and sending them on in the current environment. And partially because clinicians don't have the tools that they need to really be able to know what to do in that moment or know what's appropriate to do and what's going to actually get that patient better. And so I thought this was interesting. This picture just said, "It's official, curing patients is bad for business," was a headline a couple years ago. And it's true, though. If we actually help people get well, we're not going to have as many people going to the ER. We saw this during COVID. My ER colleague friend, he actually got laid off during COVID because people stopped using the ER for their primary care or their urgent care needs. And so it is bad for health system business if patients don't need to access these services. But this really is part of why we're talking about this. We need to really get to a point where we're actually, helping people get better and not needing us. So in the US, we have all of these. I'm not going to go through every single one of them, but the top 10 leading causes of death. And a lot of these can be prevented through, addressing risk behaviors, decreasing alcohol use, tobacco use, addressing nutrition, lack of physical activity. And more than 2 decades ago, there were, groups of people writing papers that, talked about, a lot of over 60% of premature deaths could be attributed to these unhealthy lifestyle choices, including the smoking, physical activity, and poor diet, like we talked about. So it is really a time for us to say, okay, enough is enough. We don't need to just spend money and money and money on more drug development. We actually need to address what is the problem with our system and with our environment. So chronic disease continues to drive national mortality and morbidity. And our most common therapeutic intervention is that we have 6 billion people, or 6 billion prescriptions, approximately 19 prescriptions for every American filled in 2020 alone. So let that sink in. 19 prescriptions for every American. So if you're listening to this and you're like, I'm not on a prescription myself, not on a prescription, that means there's people with more than 19 prescriptions out there. And I've filled these prescriptions and filled them up in a bag. At one point in my career, I've had people, when I worked at the VA, dumping a trash bag of prescriptions out on the table as I, trying to refill everything. So that is, our bodies are not designed to need that many therapeutic interventions if we are fueling ourselves with the proper nutrition and food. And 6 out of 10 adults report taking at least one prescription medicine. A quarter of them say they take 4 or more. So we have this overutilization, or polypharmacy, as we like to call it in the pharmacy world, increasing cost and then potential for negative health impacts. So they've just become accepted as an integral part of life. And in reality, there's so much that we can do from a prevention standpoint. And so that's really why I'm saying it's time for change. Almost 50% of US adults have prediabetes or diabetes. Nearly 74% of US adults are overweight or obese. 6 out of 10 Americans have a chronic disease, and the chronic and mental health conditions are responsible for 90% of our 3.8 trillion annual spend in healthcare. So not only do we have a problem with people actually not feeling well, we also have a problem with spending too much money on addressing chronic disease. And so the question is this model sustainable? Where do we go from here? And so, again, our current health care system is exceptional at acute care, diagnostics, pharmaceutical interventions, but it was never designed well to address the root causes of chronic disease. And so we're trained to diagnose once specific thresholds are crossed. So if someone has an A1C of 6.5, okay, they have diabetes, but what about that A1C of 6.4? That person is still metabolically not healthy. They're still in that prediabetes range, but we're not necessarily doing anything about it, or even when they're getting close to the prediabetes range, it's a continuum. We're treating based on population level guidelines. We're not addressing individual circumstances. Again, that subclinical dysfunction is not being treated. And we really feel stuck. We know lifestyle changes matter. We want to be able to prescribe it effectively and support our patients, but there's a gap between what we know matters and what we're trained to implement. And that's really where our burnout lives. That's really where providers are frustrated. And so we want to be with you and help you walk through that and help you get from I know this matters to I'm ready to implement this. And so our courses that we build, and especially this lifestyle medicine course, is really built around the simple but powerful idea that healthcare doesn't need more tools, it needs a better operating system. And so that's where functional medicine, integrative medicine, lifestyle medicine comes into play. And it's not necessarily competing philosophies. They're just different clinical frameworks a different group of people have come up with. But at their core, the models all ask what systems are out of balance, what upstream factors are contributing to downstream disease. And functional medicine really gives us the map of looking at our patient's digestion and hormone signaling and structural health and how that is all interconnected. And lifestyle medicine has given us some great evidence-based interventions as far as what nutrition, movement, sleep, stress, connection, and the connection to other people and community and what that does to directly influence our health. And integrative medicine really helps bridge the gap with conventional care. So sometimes there's a reason to use a medication, and I always call it a tool in my toolkit. This is one of the tools. I have natural and lifestyle tools, but I also have prescription tools if that's something that a patient needs. The goal isn't to replace conventional medicine. It's to make this our lens in which we view medicine and pharmacy and nursing and all of the professions together, and how we work together collaboratively to really address this chronic disease epidemic. So this is just an example of the 7 core imbalances that functional medicine addresses. So again, we are looking at things from digestion to cellular membrane structures and endocrine signaling, cardiovascular and lymphatic systems, toxicity. So these are things that we cover in our courses, and we really take this as a lens and look at how the body's functioning. How do we put back the body into working in the path of, looking at the pathophysiology, but how do we get the physiology of the body to operate how it was designed to operate? And when we are looking at lifestyle medicine, we're looking at someone's nutrition, their physical activity, their stress management, their restorative sleep, again, their social connection, and then avoiding use of those risky substances. So those plant-based nutrition, we're talking about, we need to screen people for sleep apnea. We need to make sure they're actually sleeping and they're not scrolling all night, that they're actually setting aside time to sleep. And if they're shift workers, we're going to have to figure out how we best get these patients in restorative sleep. Again, physical activity, stress management. Stress is we could talk for hours for stress. And so that's not what we're going to do right here, but we do have lots of courses and podcasts and resources talking about stress and how that's impacting our bodies. And so I wanted to leave you with a little bit about the proof that it works. So this isn't just theoretical. Healthcare systems that have integrated these models using functional and lifestyle approaches have demonstrated improved outcomes, improved quality of life, reduced symptom burden in patients, an overall lower cost of care. But also clinicians who practice root cause medicine have higher satisfaction with their patients, lower burnout, and greater sense of purpose in their work. Because when we start seeing our patients improve, the work feels meaningful again, and the visits are not just combative and you trying to get a patient to do something, but they're collaborative and that patient is really engaged. And you stop feeling you're managing someone's decline, and you start feel like you're, putting them in a place where they are going to thrive and have a longer health span. So our courses aren't just about doing more, it's just taking different actions. So I wanted to show you a little bit of that proof. I'm not going to read through every single one of these slides, but this was a Cleveland Clinic study where they showed their healthcare related quality of life improved when they were doing functional medicine versus general primary care. This was another article related to that organization where they actually did what's called an SMA, or a shared medical appointment, put groups of patients together using these functional medicine principles, actually again improved healthcare related quality of life, addressed cost and biometric outcomes. And this is a way that healthcare organizations can actually do this from a lower cost, because we have one or two clinicians leading the group. We have sometimes a good group of various healthcare professionals or interprofessionals. We might have a nurse practitioner or a pharmacist, physician alongside a nutritionist or someone that is doing, I did one with a psychologist in the diabetes space. But so much can be done in that group. And patients, the best part is the patients learning from each other as well. This particular one was a functional medicine approach to patient care, and that improved sleep, fatigue, quality of life in patients with inflammatory bowel disorders. And this one was in the Veterans Affairs Medical Center, and they actually used an integrative approach for patients with fibromyalgia and saw improvement in pain scores and impact in their quality of life and depressive symptoms. So along with that, some of the lifestyle evidence shows that we actually have improvement in our patients' quality of life and reduction in all-cause mortality and a reduction in cancer mortality in patients that included this healthy lifestyle change in their life. In this particular cohort, they were looking at smoking status, alcohol, BMI, physical activity, all of those things into their in their study. There was also one that looked at adherence to healthy lifestyle and offer comparable benefits to older adults, regardless of presence of multiple health conditions. So even people that were really sick had better outcomes and decreased mortality risk associated with their number of diseases. So we can combat the fact that you might already have some higher risk things by addressing these lifestyle interventions. And so this particular one was combining healthy lifestyle factors associated with lowering risk for cardiometabolic conditions and hypertensive patients. And so really this should be, part of our prescription, and guidelines recommend lifestyle changes at the beginning of everything. But oftentimes I don't think we account for how much lifestyle changes can actually help for patients. I love the Predimed study, which is listed on this slide, which talks about patients using the Mediterranean diet and had a 30% reduction in primary endpoints with this myocardial infarction, stroke, death from cardiovascular causes. Like that is similar to some of our other cardiovascular risk reduction data with drugs. And this also showed, we had patients from, there was a study where they were looking at stepped count, and there was a 70% decrease in death for individuals who walked 10,000 steps or more compared to those who walked 2,000 steps or less. So part of this is what we're eating, how we're moving, and how we're getting patients to do this thing. And coaching is so important as part of this process, coaching our patients. And that's really why that's part of our course that we have here. So again, burnout is a combination of that exhaustion, the depersonalization, the sense of reduced personal accomplishment. And this is skyrocketed in the last several years. But lifestyle medicine can help you as a provider as well. Looking at your satisfaction for your job, a sense of accomplishment, meaningfulness, and improving your patient outcomes, and really getting back to enjoying taking care of people, and being the healer that you set out to be. So, we really want, to talk about, how do we take your practice and your patients from this sick care system to something that allows you as a practitioner to feel that sense of accomplishment, and really learning and continuing to learn and grow with us as we continue to explore functional and integrative medicine. So what is our role as clinicians? We really want to move from that reactive to proactive healthcare system. We want to, take the power and responsibility to drive change. We also want you to have this framework for chronic disease. How do we apply the lifestyle, the gut, the metabolic, the immune drivers? How do we apply this clinically and not just theoretically? And how, again, the coaching part of it. How do you coach your patients, or how do you bring alongside a coach in your community to help your patients implement that behavior change without increasing your burnout? And so our course is really structured as why the system fails. You'll get a longer version of this presentation. What is the systems-based care that we need to do? What kind of nutrition has the best evidence? The gut, the detox, and what does detox even mean? I know that's like a buzzword, and some people are like, oh, your body detoxes, but we can dive all the way into that and look at the liver and phase 1 and phase 2 metabolism. Metabolism from a cardiometabolic standpoint, immunity, and then we're gonna do some, translating concept into real-world practice in our cohorts and the cases. And then really, how do we help patients change? How do we take them from this, contemplative, oh, maybe I need to change, to actually making action? And what does that look like for your practice? So our course covers, again, nutrition as medicine, how food becomes a clinical intervention for inflammation, metabolic health, longevity without dogma or extreme dieting, why the nervous system as far as stress and sleep and community, why that nervous system regulation is important, and circadian health is non-negotiable in chronic disease care, GI foundations, how the microbiome and dysfunction impacts hormones, immunity, metabolic resistance, detox, how do we talk about detox in a scientifically grounded, credible way that actually helps patients, why the eat less and move more fails our patients, and how we approach that from an insulin resistance and metabolic standpoint. How do we approach that differently than our traditional mindset or traditional training? And then from a coaching and behavior change, again, how do we help patients actually implement what you recommend without doing more work for yourself? And so every module builds on this foundation. And so we're really gaining a clinical framework that you can use immediately in your practice. So who is this course for? For providers seeking root cause systems-based care, for clinicians frustrated by symptom-only medicine, and it's not for patients that want quick fixes or a protocol that works for everybody, and then not for providers unwilling to think about chronic disease care differently. So we really want people on our team looking at our, in our lens about, how do we rethink how we're doing this? How do we ask questions? How do we dig for answers? And how do we look at patients and give them hope in what seems like something that continues to decline? So this course exists because we are don't want to just manage symptoms, and we want providers to have the tools they need to actually help patients, and because lifestyle medicine must be practical, evidence-based, and scalable, and because healthcare needs a better operating system. So if you agree with all of these things I've talked about today, please take the time to click below and learn more about how you can join in the next healthcare revolution and help your patients really get well.